I'm Dr. Keshishian, and welcome to our podcast series, PPE, Podcast for Psychoeducation, during the COVID-19 pandemic. Today we're going to be discussing a situation a lot of patients are facing right now, balancing the risks and benefits of medical treatments during the pandemic. Whether you have been recently diagnosed with a medical condition or have a long-standing chronic medical condition, you may be needing treatment despite what is going on with the pandemic. I'm joined by Dr. Signorelli. Hi, Dr. Signorelli.
Hello.
He's a psychiatrist in the Adult Outpatient Psychiatric Clinic at LAC+USC Medical Center and a clinical associate professor of psychiatry at the Keck School of Medicine of USC. So let's break down what we're going to be talking about today. There are many psychological issues that you might be facing right now, specifically in regard to getting medical treatment during the pandemic, especially if this requires you to go to the hospital for your medical treatment. We'll talk about some strategies to help process and cope with these feelings, and how you might be able to weigh the risks and benefits and discuss your care with your doctor. So Dr. Signorelli, let's go back to the distant past of 2019. What barriers in general do you feel like patients have when they need to take care of their medical conditions?
So I think a lot of issues patients face is they have a lot of responsibilities in their life, to just simply taking time out of their day, like getting time off from work, or they might have child care issues, or maybe they're taking care of other dependents. So it's just carving out some time during the day to make a medical appointment. Another thing is actually getting to the appointment itself. A lot of times I know transportation can be an issue. Just getting to the appointment or picking up their medications in a timely fashion, coming in for lab work. So there's a lot of barriers our patients have to overcome. So these can all be challenges that we had even before the COVID epidemic.
Right. What do you think our patients might be feeling during this time, in addition to the barriers that you mentioned?
The first one that everybody is facing is fear, and it's completely natural to have this emotion. This is a scary time. I think people don't want to risk exposure. Not only patients who need to go to the hospital or the clinic, but just the population in general. Simple things like going to the grocery store, or going to the bank or the gas station, just vital things that we do every day. It's a kind of a stressful thing to do now because we have to acknowledge social distancing, wearing masks, things that we're not used to doing. It's just totally changing our behavior. And also healthcare workers, the people that you come to for healthcare, they don't want to expose themselves for fear of bringing it home to their loved ones, possibility of having to be separated from their families, possibly being quarantined if exposed to the virus. So we're all in the same situation together, but we will get through this, whether you're a patient, whether you're a healthcare worker, or just somebody in the general population. Just things have changed now since COVID.
It sounds like what was going on before is that there were barriers, and now we've added social distancing and wearing masks and the fear of exposure, which is compounding even more the barriers to medical treatment.
Exactly. And I think one of the ways that sometimes people they deal with that fear or anxiety is denial. I think a lot of times what people will do is they try to rationalize or convince themselves that they're not as sick as they really are. They don't need to see their doctor. They don't need to seek medical care or get labs, thinking that, I'm not that sick, or I don't need to go in because I might get infected if I go into the doctor. And what exactly is denial? It's an unconscious process of kind of pushing down or burying feelings one might have when faced with a stressful or fearful situation. So let's say you have a person who's a smoker or a drinker, and they're, not admitting that their habit is bad for their health. So that's kind of an example. So for our situation of this COVID pandemic is that you might not realize that you're sick enough to go receive medical care for the fear of getting infected if they go to the hospital or the clinic when they really need to. And that actually can lead to other consequences that we'll talk on later.
So I think an example of denial when it comes to medical symptoms might be something as simple as I have diabetes, and if I don't check my blood sugar, I don't know if my blood sugars are high, so I can just kind of pretend that they're not.
Exactly.
Or if I have issues with my kidneys, if I don't get my labs checked, I might not know that I have some irregularity in my blood work.
Yeah, and I think the thing is that there's also a sense of loss of control. So where patients feel that they're not in control, and they can't really help themselves, but they are in control, and we'll talk about that a little bit later.
Well, what do you think might be possible negative outcomes if you remain in the state of denial?
Okay, so I think what's important is you have to realize the risk of staying home or confining yourself. It could actually be more harmful than the risk of going to the hospital, because you could actually get even sicker if you don't. So you could have a worsening medical condition, you could not get a proper treatment, or even be hospitalized, which is even going to be worse because you're going to have maybe even potential exposure.
Are you thinking that maybe this patient who had these types of symptoms in the past might have gone to the hospital, and now due to the fear of COVID, they would choose not to?
Exactly. And actually, there's been a lot of reports that kind of ironically, during this time where you think hospitalization visits, like emergency room visits or doctors at the hospital, would be increasing, actually ER visits are decreasing because people aren't going to the hospital in the fear that they're going to get infected. And a lot of doctors are concerned, and they're actually encouraging patients who are having medical issues actually to come so they can be treated. So we actually have seen a decrease in many areas where there's not as many hospital visits.
It sounds like you're talking about preventative medicine.
Yeah, so I think it's important. So preventive medicine is basically, you want to basically prevent things from happening before they do. So for example, you use somebody with diabetes. You take medication so your glucose doesn't go, too high. And so the thing is that you want to try to treat these things before they happen instead of waiting until they do. And then the other thing is just, the feel of lack of self-control or self-determination and trying to decide what the right thing is to do. But you do have control. If you're having symptoms, if you have diabetes and your doctor's telling you to get your labs, it's really important you come in and do those things so your doctors can keep you safe and treat you adequately. And it's important too is that they're not just there to treat your medical issues, but also talk to them how you're feeling. Talk to them about your anxiety, and just process that with them. And if need be, they could also refer you to a psychologist or psychiatrist if you're feeling depressed or anxious, because there has been increase of mental illness during this time, and it's completely fine to go seek help for that also.
There seems to be risks and benefits, and the best thing to do is talk to your doctor and have an open and honest conversation with them about how you're feeling, the fact that you're scared, the fact that you're nervous about COVID, and the fact that you might have medical conditions that need further diagnostic tests, medications, treatments.
So I think it's really important to take really care of what you're experiencing in the moment. And if you're not feeling well, that you need to take control of that situation. So if you feel like something's not right, it's important for you to take control and take action. And so basically the best thing to treat anxiety is action. So by you going to the doctor or calling somebody if you're not feeling well, that's the best thing, is you taking control of the situation.
And how do you think the healthcare teams on the other end, you being a doctor yourself, are trying to be mindful of exposure risk and what have you if the patients do end up needing to go to clinics or to the lab?
I think we're really being cognizant of social distancing. Everyone's wearing masks. So I think personal protective equipment. So it's a very important thing that all healthcare providers are, not only with patients, but with even coworkers, that we all have to be in this together.
So let's maybe recap and make sure that we've captured everything that we have right now.
With this COVID pandemic, there's a lot of fear, and a lot of times humans lead to denial with that. That's how they deal with fear. So just make sure that you're making informed decisions, work with your doctor and ask questions, empower yourself by taking control of things you can. And what is in your control is going to doctor's appointments, taking your medications, picking up your meds, getting labs for your doctors so they can monitor your medical conditions. And that's basically all part of preventative medicine. Is the goal is to take care of things you can with as little exposure as possible, because you want to prevent worsening your medical condition. And your doctors and the healthcare workers, nurses, that they're having the same thoughts as you are. They want to prevent any unnecessary exposure contact that you're having. So work with them to form a plan and make sure to discuss your feelings and thoughts so they can make sure to be on the same page with you.
Thank you, Dr. Signorelli. I think that was really helpful.
Great, thank you for having me.